President Biden and his administration have been stupendous. As a senior member of Homeland Security, and I congratulate him on that leadership, and the chair of the Bipartisan Congressional Coronavirus Task Force, I write to request your intervention in the state of Texas to allow for direct federal assistance to counties and local governments in need of medical staff and additional capacity to treat critically ill patients. I'm aware of the emergency provision of nurses to Louisiana, Mississippi, and Arizona from the federal government in response to the crisis. Is there authority in your office that would allow the federal government to respond directly to requests from county public health departments or hospitals in need of assistance during the public health emergency? Your assistance is also needed to stem the tide of infections by implementing mask mandates in the current crisis unfolding in Texas and nationally. However, Texas and Florida represent 40% and also 40% of the problem. I'm also asking for the recalcitrant actions of the governor to stop, cease, and desist, and asking the president to intervene in the executive order GA38, which combines several existing COVID-19 existing orders by his office that banned local governments, including school districts, from instituting mask mandates. I also ask that the Secretary of Education establish a mask mandate or an optional for all public K-12 education settings that qualify to receive COVID-19 emergency funding. These schools or school districts that have not received funding from the state should have the discretion to return to remote learning until the preparation as outlined by the CDC for occupancy has been met. Finally, Governor Abbott has not yet released the funding provided by the CARES Act that is allocated to schools, both public and private, to prepare to receive students and teachers back into the classrooms. Because of the Delta variant's impact of COVID-19 on children, the federal government must act to protect those in K-12. So I am indicating that there is a crisis, and that crisis has to be remedied. The governor sent out, after my press conference or my statement, the governor sent out a catch as catch can, meaning he gave permission for the various hospitals under stress to be able to contract with private nurses, to call states to be able to get nurses. Let me tell you, if you're seeing patients, if your whole hospital is focused on the patients in the hospital, I can assure you that you don't have time to engage in getting contract nurses. Secondarily, I have spoken to our public hospital system. Right now, they have made a request through this contract nursing system, and they today don't know what they might get, who is going to give them any nurses at all.